Dr. Brian Kansas with Urology Austin. I'm here to talk to you about the pneuma cosmetic enhancement of the penis. I'm one of only 11 urologists in the world currently trained to do the pneuma implant. Pneuma is a cosmetic size enhancement for men. I tell my patients all the time, nobody thinks twice about women who have cosmetic enhancements. Why can't a man have the same thing? Typically, men who are interested in pneuma just haven't been real happy with the size of their penis, and they're looking for larger girth. With this procedure, it's common to see an enhancement of 1 inch or so of flaccid length. Overall, it doesn't change the erect length, but I always impress on patients, think of this as a girth enhancement. We get a lot of girth out of these procedures. We can also use pneuma to correct very mild cases of Peyronie's disease. In these cases, I always assess the patient to see how significant his curvature is. Sometimes I actually have to correct the curvature before putting the pneuma in. Sometimes a patient will have a retractile penis that's very bothersome to him. We can consider putting in a pneuma in this situation because it will give him a very reasonable amount of extra flaccid length. As far as buried penis goes, this is a different situation. I need to assess the patient and examine the patient. Oftentimes, they need a completely different operation for buried penis. This is something I can determine with a single office visit or even a telemedicine visit, as long as I can see it, maybe have some pictures sent to me. It must be made very clear to the patient that pneuma is not a treatment for erectile dysfunction. Again, pneuma is a size enhancement only. It's not a functional implant like an inflatable penile prosthesis. As far as assessment for candidacy for a pneuma, the process happens in multiple stages. First, we like to do an initial psychological evaluation of the patient. Essentially, we're screening for body dysmorphic disorder. This disorder is characterized by a person's obsession with what they believe are physical flaws. Depending on the patient, I can also have them screened by a certified psychiatrist if that's necessary. I also need to get penile measurements and to show the patient pictures of different penis sizes. This helps them see where they are today versus where they think they're going to be and where they will be after the operation. This allows me to fully set their expectations on what we can actually accomplish with their operation. As far as being a candidate for the pneuma procedure, there really are no major exclusion criteria aside from psychological issues as previously mentioned. As we discussed prior, if the patient has severe Peyronie's disease, that will need to be addressed preoperatively. Also, all pneuma patients must be circumcised. If they're not circumcised, this must be performed at least 10 weeks prior to the procedure. Contraindications to placing a pneuma implant would be any type of prior penile enhancement surgery. This would include penile fat injections, penile filler injections, penile silicone injections, penile fat flaps, penile alloderm, or penile urethral. People with diabetes and heart disease need to be assessed before moving forward. Men with diabetes are at higher risk for infection after this procedure. Patients with heart conditions need to be cleared by their cardiologist preoperatively. I also request that patients on blood thinners stop their medication with clearance 5 to 7 days preoperatively and 3 to 5 days postoperatively. This is to minimize bleeding, bruising, and swelling. When I see a patient in the office during a consult, after we've gone over measurements and sizes, I like to actually have them hold the pneuma device. It's a soft silicone implant that comes in 3 thicknesses and 2 lengths. These are referred to as large, extra large, and double extra large. The majority of patients actually get the extra large. This is the pneuma device here. This is the extra large thickness and the regular length. The extra large thickness will typically add a solid 1 to 1 1/4 inches of circumferential girth to the patient's penis. The pneuma device will not break down, it will not melt, it will not fracture or leak in the body. Pneuma is performed as an outpatient procedure at a surgery center under general anesthesia with some local anesthesia as well. The operation typically takes 45 to 60 minutes to perform. The operation is performed through a small incision. I then basically flip the penis inside out, degloving or taking the skin off the penis from the inside. I then take the pneuma device and edge it just underneath the head. I then attach it with a series of sutures across the edge and then down the sides. These stitches help to hold the sides down as well. Once this is accomplished and I'm happy with the way that it looks, I wash everything out. I leave a drain in place. I close the incision in 3 layers. After the procedure, the patient goes to the recovery room where they'll awaken and eventually be released to go home after they void. The patient will be scheduled to see me in the office 2 days later so that I can take out their drain. They're then scheduled to see me about 6 or 8 weeks later. At that time, typically I can clear them for use of the device. I do recommend that the patient refrain from using the device with sex or masturbation for an absolute minimum of 6 weeks. As far as complications and side effects, I remind the patient that this is a surgical procedure. They're going to be pretty sore for a couple of weeks, and they'll probably have mild tenderness for about 6 to 8 weeks. Also, the infection rate of these is about 3%, so that can happen with any surgery. After the procedure and clearance, the patient shouldn't have any issues with the device or with reaching orgasm. They do have a very small scar. Because pneuma is a penile cosmetic enhancement, this is a completely elective surgery. Commercial insurance and Medicare do not cover the pneuma procedure, so it's an out-of-pocket cost. The cost of pneuma is standardized, so no matter where you have your pneuma done in the country, you will pay the same amount. In closing, pneuma finally offers men an option for size enhancement that looks good and works well, compared to prior techniques that just didn't last and they just didn't look good. If you're interested in learning more, I'm happy to see you for an initial consultation in the office or via telemedicine. I'm happy to see anyone from here in Central Texas or around the country. Thank you for watching our video about pneuma. I'm Dr. Brian Kansas with Urology Austin.